You've heard, I'm sure, that America has the best healthcare system in the world. But I bet you've also heard that we have the worst. Now, how can we reconcile that? Well, it turns out that they're both correct, because we have this incredible paradox in American healthcare. I'm going to try and explain that to you in the next few minutes. I'm Dr. Stephen Schimpff, and to discuss this paradox, we need to start, on the one hand, with what's going really well. We have extremely well-educated, well-trained providers, doctors, nurses, nurse practitioners, physician assistants, pharmacists, dentists, you name it. They're there and they're committed to helping us. We are the world's envy with regard to biomedical research. The work that goes on in the National Institutes of Health, at research institutions and medical schools across the country, bringing out new knowledge all the time. Very valuable, very important, and clearly America's at the forefront. The pharmaceutical industry, new drugs that are life-changing, life-altering on a very regular basis. Same can be said for the biotechnology industry, with new drugs that use the biotechnology technology. And then there's the medical device industry, large companies and small, some a very entrepreneurial person working in their garage, but all bringing forth new devices that are having a real impact in our health. There's the diagnostic industry. You know about MRIs and CAT scans. You may not know about handheld ultrasounds that can do all sorts of incredible diagnostics today. There's the genomics industry, I'll call it industry, that's part of the diagnostics advances. So all of these are things that we can be excited about, certainly proud of, and feel very relieved that our healthcare can benefit from. But then there's the other hand, and the other hand is a very dysfunctional healthcare delivery system. Let me try and explain. Well, in fact, you know it. You know it when you go to the doctor, or actually when you call for an appointment with your doctor, and you have to wait an average of 20.5 days in this country. And then when you get to the waiting room, aptly named, of course, waiting room, you have to wait 30 to 60 minutes on average. And then when you get to see the doctor, you get 10 minutes. Somehow, that doesn't seem quite right, does it? You pay a lot for your medical care. Your insurance costs are going up, and yet that's not enough, because now you have high deductibles and high copays. We know that we pay more, or you probably have heard that we pay more per capita than any other developed country, 2 to 3 times more. And yet are our outcomes better? Well, in some cases, yes, but often not. Let's take just lifespan. Our lifespans are rising, and they're pretty high, but many other developed countries have longer lifespans than we have. Same thing goes for infant mortality. Yes, infant mortality rates are low, but they're not as low in America as they are in other countries. So we have this paradox. We have this paradox of so much that's there, that's available, that could be to our benefit, and yet this dysfunctional healthcare delivery system that means we're not getting what we should be getting. Frankly, I find it amazing that as Americans we tolerate it. So this is the first of a series of talks on what's happening in American healthcare. The next time, I want to talk to you about the developing crisis in primary care.